It is time to focus on your skin, and here with some reasons to call a dermatologist is Dr. Lauren Karpinski from Apex Skin. It's good to have you here.
Thank you. It's good to be here.
So I know you probably see a lot of different things. I want to start with rashes because that's probably one of the main things people come in and like, what do I do? What is this? How do I treat it?
Okay. So rashes can come up anywhere on the body. One of the places that we commonly see rashes is on the legs. A lot of patients will actually go to their primary care provider first before trying to get in to see a dermatologist. I know we sometimes have long wait times.
Everyone needs their dermatologist. We know, we understand.
But rashes on the legs can be a lot of different things, and it can be inflammation in the skin just from swelling. We do see that they're mistreated a lot, whether it's with topical things or pills like blood thinners and antibiotics that patients really don't need and can be dangerous. So we would like people to come see us first. There's usually a lot less invasive things that we can do to help get rid of that rash a whole lot quicker for them.
Okay, that makes perfect sense. Here's one that I don't even like saying, but I'm going to say it because I have to. Warts. There's something about them that just, but that is something very common in a lot of people.
Yeah, warts are caused by a virus that's pretty much everywhere in our environment, so you can pick them up anywhere, can get them on your hands. People really don't like getting them on their feet. But warts are also sometimes very difficult to treat, especially when they're around the fingernails or they're on the bottom of the feet. Again, if you come see your dermatologist, we usually have quite a different number of things we can do to get rid of those warts. We're also a little more aggressive when it comes to freezing with liquid nitrogen, often than other providers. And sometimes warts just don't respond to liquid nitrogen, and then we do have other options like laser treatments and even injections for the warts to help them go away.
So why be in pain and suffering when you can go to a dermatologist and get the situation fixed? What about poison ivy? You know, especially we're heading out of summertime, but still, that's one that kids, I mean, you probably see a lot of kids too with that.
And adults, and those people are miserable. It is a blistering, itchy, painful rash that you can get almost anywhere depending on what you are doing out in the yard or on your vacation. Poison ivy usually can't be treated with many topical things. Sometimes, depending on how severe it is, you can get some anti-itch things over the counter, but in a lot of cases, if it's severe and it's blistering and you're uncomfortable, it needs a much longer course of oral treatment that your dermatologist would be best to see for that. We do see a lot of patients going to the ER and urgent cares, and they do get the oral steroid treatment, but usually not for enough time. And after a couple weeks, that rash can come back if you weren't treated for enough.
Okay, what about acne? That's a lot of people, of course, a lot of ages. Sometimes people get it later in life. Sometimes they just have it when they're younger, but you see a lot of that and you can help with that.
That's true. There are a lot of different types of acne, whether it's in men or women, boys or girls. It shows up at all different times of life, and it shows up on different parts of the face. And depending on the type of acne that you have, sometimes it's just blocked pores, other times it's inflamed pustules and things that can be really painful and deep under the skin. The treatments really vary. And dermatologists can come up with a great plan for you that usually incorporates a couple different things, prescription grade medications. And just because it's available over the counter doesn't always make it safe. So just a mention to any females who might be pregnant or breastfeeding. We are specially qualified to treat your acne at those special times of your life. So,
well, thank you, doctor, for being here today. Apex Skin, again, if you need to go to get those yearly exams too, not just for your skin, but for the mole suit, get those checked. Thank you so much. Always a pleasure having you here.